Hi, I wanted to just talk to you a little bit about the common ailments and things that affect people moving more often and things you'll see more commonly in frailer older people. Firstly, there's a series of things called the geriatric syndromes. I've just reached 50 and I've started to feel some of those. So, first of all, immobility. We do less activity as we get older, and therefore things take more time, they perhaps take more energy, and it's harder to keep active if you don't stay active. So we get stiffer. Of course, the other things that are common as we get older are things like incontinence or issues with leaking. So many older people start avoiding going places just in case there's no toilet nearby, they can't get there quick enough, and that very much limits their activity. And yet, interestingly, those people that are more active tend to have less problems with continence. The other thing, of course, is foot health. Sore feet, corns, calluses, bad toenails, all of those things mean that it's uncomfortable to keep moving. And so if we don't keep our feet healthy, we're more likely to avoid activity. Eyesight problems and hearing problems mean that perhaps you don't not quite aware of what's going on, and you perhaps might get a bit worried about whether or not you're going to get knocked over by somebody or something's going to come and bother you, or whether or not you can find where you're looking for. So all of these things can potentially have an issue. And then of course the medical conditions which are common in older age, heart conditions, angina, heart attacks, stents, all of these things mean that some people actually believe that they actually might harm themselves by being active. They might bring on a problem with their heart. They might bring on some angina. And yet evidence is clear. The fitter and more active we are, the more we can do without bringing on an angina attack. And actually some people can reduce their medications if they get more active. Breathlessness is another big issue as we get older. And this could be due to a medical condition such as COPD, chronic obstructive airways disease, or it could be emphysema, or it could be asthma. There's all sorts of potential reasons, but actually, do you know what? Most of the time, breathlessness is just due to deconditioning. If we don't stay fit, then the slightest activity really taxes our systems, and we tend to get more breathless. So if someone hasn't got a diagnosis, but they tend to get breathless if they walk a little bit faster or a longer distance, then again, the importance is understanding that the more activity they do, the more they can go, the further they can go without getting breathless. It will be built up gradually, but it's an important barrier to dispel, because actually physical activity will make you less breathless over the long run, so you can do more with more energy. And the other things you need to think about are osteoporosis. If someone's had a few broken bones or they're a faller, they tend to be worried about falling, as do everybody around them. So friends, family, carers, everybody seems to wrap them up in cotton wool, sit them down and do everything for them. But actually this has the complete opposite effect, because one of the major risk factors for falls is not having good enough balance or mobility to correct a trip. So if you don't have a reaction speed, if you can't get the foot or hand out quickly enough, or indeed you don't have good core strength, it means the slightest thing, the slightest trip, and you'll be on the floor. And then, of course, there's the ability to get up again off the floor, because long lies are worrying for anybody. If they're in their own home, the potential of a long lie all night or all day before somebody comes to visit means that they essentially stop moving about just in case they fall, and they might have the dignity, the lack of dignity of wetting themselves or other problems with not being able to get up. And again, if we're more active more regularly, we're more likely to regain or retain the skill to be able to get up off the floor. Something we've always done, we learned as a child, and then we avoid doing because we avoid getting on the floor. So, of course, it's a big jolt to people when they've had a fall. Physical activity is vital for bone health. If you don't weight bear, you lose bone, literally in front of your eyes. We know this from studies of bed rest, and we know this from much of the work currently about the lack of activity that goes on in hospital and the potential problems with function when people leave. Quite often people go into hospital due to a medical problem. They're stuck in there for a while. They don't move while they're in there. And essentially they leave with less ability to function than when they went in. And that's often not due to the health problem. It's due to not moving while they're in hospital. So it's really important to think movement all the time. With whatever you can do, build on it. If at the point you can't get up off your chair, perhaps you're chair bound and you need a hoist, then just think about helping people when they're lifting you, putting in some effort, some body effort, using the grip rails to help yourself along with the hoist. And funny enough, many people eventually move away from needing a hoist altogether. It just requires muscle movement, and muscle movement is retained even in dementia. So, one of the things we see that's common in people, even advanced levels of dementia, is if you set them off on a task that they've done in the past, the body memory comes back and they do it. They may have forgotten that they can do it, but you just have to prompt them and they'll often regain that skill or remember that skill. Other issues that might affect us as we get older. Quite often our peripheral vision changes. It comes in, so we see less of what's going on around us. That's why quite often you'll see older people walking along, head down, staring at the floor, and you'll walk up behind, they didn't hear you, and they'll jolt because all of a sudden you're there. So just simple things like making sure that they stand upright when they move their head from side to side to check what's going on, make sure they've got the right hearing aid, make sure they've got the right glasses on and they're clean. These things are really important to just help the very frail older adult have the opportunity and the capacity to keep moving. So I suppose one of the things I want you to remember is that you need to dispel some of the myths, and myths such as I'm too old to move, I'm too old to benefit. In actual fact, it's really important for them to understand that with any medical condition, unless it's acute, it's good to move. Symptoms are reduced, people can have more capacity, they can do more for longer. Even something simple. I can remember working in a care home many years ago, and we had got a new piece of equipment. It's called a balance master. Essentially, it was a wobble board, but it was motorised, and there was a big stable bar to hold on to. So I started by getting people to stand on this, and it rotated, and they had to hold on to the handrail, ideally try and let one hand off, and maintain upright position while the base moved. And I can remember one particular lady, she could literally manage about 30 seconds on that before she really tired. I had to get her down, sit her down, and basically that was it for the day. But over a period of weeks, she managed longer and longer. And believe it or not, by about 4 months, she was standing on that for 10 minutes without holding on. So her balance reflexes came back, the strength in her legs came back, her stamina came back. But it was just doing a little bit to start with and building up on that slowly. Now, this particular lady had severe osteoporosis. She had open heart surgery. She had cancer. She had all sorts of problems. And essentially, the family had just decided that was it. She couldn't do anything. She needed to go into care to be looked after. But you know, after getting her balance better, she started walking outside with a Zimmer, but walking around outside. And over time, she started being able to go out again with her family on day trips. It was practically a miracle, but that was just because of consistent effort to work through and overcome the barriers, build up gradually, just give her a bit of time to get used to things, and win-win tasks, things that she could do, that she could build on. It made a huge difference. In actual fact, she went from using oxygen overnight because she just did not have a good enough lung capacity to maintain her oxygen levels. Over time, she got rid of that oxygen overnight. So it is possible, but it just takes time, and it takes learning what their barriers are, working through with them for them to understand it's safe to exercise and be mobile, and important to be mobile and move as much as possible. So I hope that although many people you work with will have multiple medical conditions and be on many medications, that you appreciate the value of moving more, and that you understand that they understand the value of moving more.